Pascale-Julie Robinson, you're from Canada, Montreal.
Yes, I live in Montreal. I would say like North Shore of Montreal. So it's a city called Laval, but you can say Montreal, Quebec, Canada.
Yeah. Okay, so more the French part.
Exactly.
Of it.
So my first speaking language is French. So that's why I have a little accent in English, and I'm trying to learn Dutch.
Oh, that's pretty cool.
But it's not easy.
Yeah, I believe that.
Yeah.
German is hard.
It's a very, very big challenge,
Yeah.
but I'm working on it.
Well, that's great.
Yeah,
So
yeah.
French, German, and then English, of course. Anyway.
Yeah,
So.
exactly. Yeah.
Pascale, you've been an osteopath for over 20 years now.
Yeah.
And you specialized in working with kids.
Yeah, I would say that since the beginning of my practice, almost, I started working with babies. It was not necessarily my choice at the beginning, because when I was a student in osteopathy, I thought that I would be more with in sports therapy. I was doing a lot of sports at the moment, so that was the field of practice. I was looking into it. And my first job as an osteopath was in a medical clinic for pregnant women. So I received a lot of pregnant women in my practice and then their babies. So yeah, I discovered something that I didn't plan to go for.
Yeah, it's most of the time like that.
Exactly, the life just gets you where you should be, because like 20 years later, it's a real pleasure for me to work with babies, kids, teenagers. So it was the good path for me, but I didn't knew it at the time.
Okay, but there are a lot of athletic aspects with children as well, aren't
Exactly.
there?
So
Yeah.
I realized that, and it's funny that you mentioned that, because in my first years of practice, I say, okay, like babies are little athletes.
Yeah, okay.
And you have a lot of common point between athletes and baby, their motor skills acquisition, all the growth they're going through in the first year. So yeah, so finally, if you love working with athletes, I think you can love working with babies.
So maybe more just with the neurological system as well, because
Exactly.
that's what you address.
Yeah, because when we're talking about the motor skills acquisition, we're a lot talking about the nervous system, the growth of the nervous system, the maturation, and they're changing so much in the first years, and they're moving all the time. So yeah, they're little athletes, and one of them will become athletes
As
too.
well.
As well. Yeah.
Okay, but that's almost the first question already. Yeah. So, what fascinates you about working with children?
I would say it's that they're really interesting in many ways. I would say the first thing in my everyday practice, it's always positive, or most of the time very positive. I like working with adults, but it's not so easy. The life today isn't so easy. A lot of stress, a lot of anxiety. Some adults are not taking care of themselves. So it's a lot of I'm in pain, I have stress, I have anxiety. So at the end of your day, it can be exhausted. And as a therapist, with babies, it's completely different. They are growing, they are changing, they want to learn, they want to move. Every time you normalize a little restriction on a baby, he's going to use that mobility right away to move, to crawl, to stand. So it's very positive. They change really, really fast. So you have really nice results. So I would say at the beginning of your practice, it can be very, very rewarding to say, okay, I did that with a baby, And the next day he was crawling. Oh my God, that's amazing. And you go from surprises to surprise, because like 20 years later, they still surprise me every day.
great.
And sometimes I say, oh my God, okay, we can do that in osteopathy. I didn't know that.
Yeah, that's good.
Yeah, so the positive way, the energy that they're bringing into the treatment, into your life, they communicate a lot. And that always surprises me a lot too. They answer your question, they have reaction, like they're not answering with words, but they're answering with their eyes, with their movement. They also collaborate in the treatment in a very different way.
Yeah, that's very interesting, because this would have been my next question. How do they communicate when they're just like 4 weeks old? And what kind of answering is it? It's not blurred, probably. It's just very clear.
Yeah. It's always surprising, because when I was a student, I will remember that day for the rest of my life, because I did my study in Montreal, and my teacher for pediatric, which is Denise Dufresne, she was talking to babies a lot. And back then, I was like 22 years old. I was looking at her and say, oh my God, she's talking with babies, but they can't understand. What is that exactly? And then you see another baby, and you see another baby. And after many babies, you say, okay, no, they communicate. So, and she was explaining to us back then that they don't understand necessarily the words, but they understand the energy of the words. So the way you're talking, your facial expression, the sound of your voice, and yes, they answer you. So the first thing I'm doing when I'm treating a baby is to ask them, can I touch you? Can I touch your head? Can I touch your pelvis? And sometimes you have a blink of the eyes, a little smile. They're doing a movement. They're responding in their own ways, and they're showing us a lot of things. The first time that you're working on the stomach of a baby and he places hands on your hands,
oh, that's
you
crazy.
say, oh, this is very special. Okay, the first time you say, oh, maybe it's like a random movement.
Yes.
And then the second time, and the third time, and 100 times later, you say, no, that's not. This is not a random movement. He wants to tell me something. So you can feel the baby is applying more pressure, and then he's gonna take off your hand, doing some movement. So most of the time, I say with babies and kids, when we're working as osteopath, we have the easiest job on the planet, because they're doing all the work. We're just here to, I'm there to be a fulcrum. So I'm going to place my hands, and then he's going to move around, do the movement, and finally they're doing the work.
Great. So you can address very exactly what they want, and that's maybe the reason, I don't know, why it works that well.
With adult, and it's really okay that we're working in this way, but with adult, for example, someone come to your office with a lower back pain, and you say, okay, I have some pain in my back, it goes down in my legs. For sure, you have to keep that in mind, and even if you assess that person and you find that it's not the left lower back, which is the problem, but it's the right ankle.
Yes.
If you only touch the right ankle, maybe
brain kicks in.
Yeah, the client will say, yeah, but my pain is in my back, and you just touch my ankle, because you need to touch where the pain is.
So it's more about socializing what they learned and what they are thinking. This has to be like this.
But the baby won't say that. So when I'm doing my assessment, I think that with babies and kids, we're going more to the root cause of the dysfunction, because we're not influenced by the sign or symptoms. It's really my assessment and say, okay, yeah, that's the main cause, so I'm going to address that, and now you can see all the results that you can have in osteopathy by working on the main cause. So it amazed me all the time to say, okay, he was having reflux, and finally I addressed the pelvis, the cervical spine, and the ankle, and the reflux is gone. Say, oh my God, what is happening here?
Yes.
And maybe with an adult, I would have gone more directly to the symptoms that he was describing.
So do you think, I've read that you've been to many places for teaching.
Yeah.
Are there differences between the babies and the culture, just to add on to that idea of just working with the brain, or maybe the interaction with the parents and the symptoms?
I would say it confirms me that communication is not about words. Because last May I was in Brazil. I don't speak Portuguese, but I was communicating with them very easily. Mm-hmm. When I'm treating babies here in the school, when I'm teaching, I don't speak German, so I cannot really communicate, but we still communicate very well. So at the end, we're all one big family, and it's me, the parents, the baby, and we find a way to understand each other. And so it's very special because we found a different way to communicate. And it confirms that, okay, he's going to show me by his posture, he's going to show me by his movement, how he places his hand, how he places his body, how he reacts. Sometimes they're smiling, sometimes they have, they can cry to express some emotion. And yeah, at the end, so there's not a lot of difference in between the countries.
Oh, interesting.
Yeah.
So, and, what complaints or problems do children most often come to you with?
I would say that when I started 20 years ago, osteopaths were well known for bones.
Yes.
So neck problem, back problem, knees, ankles, shoulder, but mainly the spine, I think. So for the babies, it was a lot of flat head, plagiocephaly. But now people realize that we're much more than that. And it's funny because in my practice, since I would say the pandemic, so since the last 5 years, I'm having a lot of babies with breastfeeding issues. It's becoming like my main practice, I would say, breastfeeding issues and digestive issues. And exactly like at the beginning, I didn't choose necessarily to work with kids. For breastfeeding issues, it's like you receive a kid in consultation, he has some breastfeeding issues, you help him, the mom is very satisfied, then she's going to talk to you, to other mom. So like from one person to the other, you have more of those kind of clients in your office, and then you say, okay, 5 years later, finally, every day I have little babies with breastfeeding issues. And I really appreciate that because you discovered a new field of osteopathy.
Well,
So,
actually, it's combining all the pregnant women and then breastfeeding, so being all around the first weeks.
Exactly.
Yeah.
So because of that, I'm seeing very, very young babies, because with breastfeeding issues, you want to see them quite fast because you can really help them in the first days, first week after they were born. So like my clients are a lot between 0 and 1 month. And a lot of them with digestive issues, I would say the 3 and 4 months. So maybe half of my clients are from 0 to 3 months.
So
they're very, very, very small.
Do you think there are even more people that have, or babies that have breastfeeding issues than maybe 100 years ago?
I think that we're really aware of the importance of breastfeeding those days. As a mom, because my kids are now in their early 20s, so 20 years ago, breastfeeding was, we knew it was good, but not as much as we're doing today. So the mom were breastfeeding for 6 months, and then we're switching to the cow milk quite fast. Mm-hmm. And years after years, the study showed us that it was really, really good. So there is a big change in the way that people are seeing breastfeeding now. So I think a lot of moms want to breastfeed. They want to be comfortable doing it. They don't want to have pain. A lot of nurses, doctors, breastfeeding specialists are aware of what we can do in osteo. So I have a lot of reference from doctors, nurses from the hospital. So it's changing a lot at the moment. So more women are breastfeeding. More professionals are aware that sometimes the issue can come from the baby. So osteopath can be a good tool to address that problem.
Absolutely.
And we're more aware of the importance of breastfeeding and being comfortable while breastfeeding and for a long period of time.
Yes.
Because if you want to be comfortable for a year, you need some help.
Absolutely. And what are the most problems for the babies not to get enough milk out of the breast?
When you gave birth, you have a baby and more anxiety as a mom.
Yes.
So I think that a lot of moms are putting too much pressure on their shoulders, and sometimes it's my fault. I don't produce enough milk. I didn't have the milk was not there in the first days because of the way the baby was born for different reasons. So it's a lot of pressure on them. But in the clinical aspect, we see more issues coming from the babies. So say if we help the babies, we're going to help the mom at the same time. Just think like, is he able to open his mouth? Mm-hmm. As simple as that. He could have some compression to the jaw while he was in his mom's belly or during the birth process. Mm-hmm. So maybe a compression and he cannot open his mouth. The way he places his lips. Mm-hmm. So if you're not placing your lips properly, maybe you're not going to latch properly. Maybe you're going to have some gas. So some digestive issues. There's some fascia tension, muscular tension that we can get rid of quite easily with little exercise at home. Mm-hmm. And it can change really, really fast. So sometimes you can have a lack of milk production. But if the baby is not, if the suction reflex is not good enough, is not going to stimulate the breast properly. Mm-hmm. So it's always a reaction with the baby and the mom. It's both of them who are involved in that process.
So I've heard that many osteopaths recommend
the tongue tie.
Cutting.
The famous cutting tongue tie. Yeah, so we have that a lot in Montreal. Mm-hmm. And for some of them, for some baby, it can be really good and really helpful. Mm-hmm. For some of them, it won't change. But my approach in my own office is to inform the parents that, okay, there's a lot of things that we should look at. And yes, we can consider to cut the tongue tie, but first, Is the baby able to open his mouth?
Yes.
Is there some movement of the tongue? Is the lips okay? Is he free at the cervical spine? Because when a baby is breastfed, he needs to move his head. Maybe he has a neck torticollis, so he's not comfortable on one side. So there's a lot of things that you should check and address maybe before going to the surgery.
Yeah, that's a good recommendation.
But the problem is that we have to do it really fast. So sometimes, a baby is born, then you start breastfeeding. Sometimes the problem will show up at 5-6 days after birth, and now the mom is in pain. Sometimes there's inflammation, the baby is not gaining weight. So it's always a stressful situation because you don't have like 3 weeks to address the problem. So I think that sometimes they're trying solution. They say, okay, we're going to cut the tongue tie and we're going to see if it helps or not. So sometimes I receive baby in my clinic and the tongue tie was already cut, and we're going to work on the rest, because if they did the surgery and it didn't help, you still have to address all the other restriction and tension.
Can it be bad for the baby as well to cut the tongue tie? Do you have any bad symptoms, so to say?
It always depends. For some of them, it's a complete relief. They have the surgery, and the next day they're completely fine. They're gonna take the breast properly. For some of them, it won't change, and unfortunately, for some of them, because they experience a little bit of pain, sometimes they're going to change the way they're drinking for a few hours or a few days. So sometimes we don't have good result, but it always depends. But I would suggest to the mom, like if you're a mom, if you're pregnant at the moment, read about breastfeeding, find some people around you that can help. It can be one of your friends who experience breastfeeding issues that can give you advice. You can go in Montreal, we have some association where you have nurses or lactation consultant that you can refer to if you have questions, if you have issues. So you have to be surrounded by many people, a nurse, a friend, a lactation consultant, and don't wait. If you see that there's a little bit of pain, discomfort in the first day, call someone. Make sure we have to check the position of the mom. Does she sitting properly? Does she seem to be comfortable when she's holding the baby? Is the baby in a good position? Because sometimes we can change a little bit the posture of the baby. So they really need help. Because for some of them, they give birth, they put baby to the breast, he's gonna drink like if it's completely natural, but for some of them it's more complicated than that. So if you have good advice right from the start.
Yeah, it's very good to do it before.
Sometimes the nurses are doing their best, but sometimes they have their own experiences, so they're gonna give you advice. But you can receive different advice from different person, and it doesn't necessarily fits with you. So you really have to say, okay, is that advice good for me? Is it working? If not, maybe I should try something else. But yet to have a good team around you and to be aware of like the first sign, don't hesitate to ask for help. And in my clinic, I'm working a lot with lactation consultants. So most of the time they're seeing the lactation consultant. So she's going to look at the posture of the mom, the baby. Is the baby opening his mouth? She's going to check the tongue tie. She's going to check the way he's feeding himself. And then if she sees any issues, she's referring to me as an osteopath, and I will look at the posture, the mobility, the tension, the restriction to help both of them, and we work together like that, and we have good result working as a team.
Yeah,
Yeah.
it's always the best working in a team, and then
Yeah,
seeing the individuality of the person as well.
Yeah,
So that's
yeah.
what's not recommended. It's just one size fits all thing. So yeah, maybe this could lead us to the next question. You said you're working especially with very small babies, but do you also believe, or what's your idea of what age groups need osteopathic support particularly often besides those very, very young ones?
You know, the way I'm working in my office, and this is very like my personal way of thinking. In Montreal, I'm teaching the course on motor skills acquisition in the first year since, I would say, 15 years. So I'm really aware of the posture, the movement in the first year of the baby. So for sure, you need to see them right away after birth. That's the best thing that you could give to a newborn baby. So between 0 and 2 months. After that, if everything is going well, you can check all the motor skills steps. So for example, at 4 months, he should hold his head properly. He should move his head in every direction. So is he able to do so? So you can show the parents a few steps. 6 months, he should be starting in the sitting position. So as a parent, do you see that your kid is able to sit properly, like to be balanced on his pelvis, to have a straight back? Is he mobile in that position? Is he able to turn to the right, to the left? Does he seem to be comfortable in that new position? Then, is he able to crawl? Like with both hands, with both knees? Is he using his spine properly? Is he able to do that movement? So when everything is going well with health, digestion, you can look at the motor skills. When they're standing, how is the posture adapting to that new position? On their feet, their ankle, their knees, their hip. So that could be great to see them like, I don't know, like maybe 3 times in a year to see how the posture is adapting to all those new motor skills, to those new movement, to those new posture. So I would say for me, 2 months, 4 months, 6 and 12 months would be very, very specific time where I like to see them back in my office. And if everything, like if every step is completed the right way, you have to look like, for example, digestive issues. Does he poo every day? Is it easy for him to poo? Is he spitting up, vomiting, reaction to the vaccination? Or like when they're falling, they're hitting their head. So many reasons. But to have a few follow-up in a year, it's a really great idea.
Just always the turning points as well when they change.
Yeah.
Okay. So, and what is beyond that? It's because of the growing of the nervous system, or what you, or more like blockages of certain kind of the spine, or maybe of other bones?
I would say what I see quite often, like for example, you have a little baby in your office with a neck torticolis. So the head is inside bending with a rotation. So you see him like, for example, between 0 and 3 months, and everything seems to be good after a few sessions. So the mobility is good, the posture is good. But we have to make sure that when that kid is going to be in the next step against gravity in the sitting position, how his body will adapt to that new posture. because it's a really big challenge for them to be from the stomach position to the sitting position. So sometimes we can see that, oh, you can see the little side bending and rotation is coming back. Not because the problem is coming back completely, but maybe there was still a little bit of tension, and in a new standing or sitting position, you can see the tension coming back a little bit. So we just have to balance the body and say, okay, we make sure that there's no tension in a new movement or new posture, because sometimes you can, like I'm seeing kids of 5, 6 years old, and you can still see in their posture that as a baby they had a little neck torticollis.
So do you even can treat babies later, so to say, like with 4 or 5 years with that problem from before that?
From the beginning.
And then you get it out, or is it still persistent in the system?
Most of the time we can get rid of that problem because it's only a matter of like growing really fast. All the fascia, the muscular chain are adapting really, really quickly. So the tension was there when he was born. We address it as osteopath. Maybe he was seeing a physiotherapist. Maybe he had to do some exercise, and everything was quite well. Mm-hmm. But in the body, in the tissue, sometimes you still have that basic tension that will reoccur. So if we can balance the body later on, we're going to get rid of that. And I'm pretty sure that we can avoid a lot of issues that we're seeing on adults.
At first at school, maybe?
Yeah.
I'm just thinking of my kids.
Yeah,
so,
because and a very challenging year for them, it's when they're just getting into school. Mm-hmm. So around 5 years old, 6 years old, they were in kindergarten. So they were playing a lot, they were moving, they were standing. And now they're starting to school, especially like in first grade, when they're starting to read and write, they're way much more in the sitting position. Yeah. So at that age, especially, I think that it's a very good moment to say, okay, let's do a little general checkup once a year. And as I told the parents, it's like it's the same with your car. You're going to go with your car to the garage once a year to balance, to make sure that their direction is okay. Yes. We have to do that with our body, and especially with kids, because when they're going to start sitting, are they comfortable in that position? Mm-hmm. Are they well adapted to do that new posture? So if we can release the tension, he's going to be more comfortable at school. They're going to have more mobility, more flexibility, and the posture will improve. Mm-hmm. And I gave a lot of exercise, and kids of that age, they love to do exercise at home, because they feel it in their body. Say, okay, yeah, after my osteo session, I feel more relaxed, more loose. I'm going to keep that at home. So 5 and 6 years old, it's a very, very challenging moment. And teenagers.
Yes.
we talk a lot about and unfortunately, they don't come to see us a lot.
Yes, yeah.
And I think they have a lot of issues, but the teenagers are very fascinating me because they don't complain. They don't complain enough.
Yeah, I think it's because of all the puberty stuff going on and just finding not really well in their body, but we say, okay, it's because of your growing up and your body doesn't feel right because of the hormones, and then maybe we dismiss this kind of part.
Because there's so many things happening with teenagers. I would wish that they take care a little bit more of themselves. But it's a very challenging period of time, because when you're 5, 6, or 8 years old, okay, if you mention, okay, I have a neck tension, I have a lower back pain, your parents will take a session with the osteopath. So your parent is taking the decision for you, and you say, okay, I'll go, and then you say, oh, I'm feeling better. Teenager, they're not complaining a lot. Sometimes I think that, as you say, there's so many things happening at the same time in their body that I think they just don't feel it.
Yeah,
Because
they can't
it's too
address it,
much.
yeah.
So I feeling like my hormones, I'm changing, I don't understand myself. So my back pain, I don't care. Like it's too much information.
And don't even say it to mom or dad because
No.
they're just evil right now.
Yeah,
so,
exactly.
yeah.
But I think that they should, I wish they would consult more.
Yeah.
Yeah, yeah.
So there's just one question popping up in my mind when we're talking about the breastfeeding issues, and we see then the teenagers, and they often get brackets.
Yeah, yeah.
So this is very interesting because they just get it, and then you get a retainer. You know, it's the same word in English, and then everything seems to be fixed until they get out, and then it comes back. So, what do you think? Is it better just to see an osteopath as well, because like a retrognathie.
Yeah.
It's the same, yeah. Like when the mandibula is not very growing enough, and the maxilla as well. So this is maybe something we could address as well.
Yeah, and it's at least when they have braces, sometimes they have jaw tension, neck tension, headaches, and those ones, they are coming in my office. So, see, good. They're coming because of the braces, but I'm going to address
The whole system.
the whole system. So I think, and over the years, I realized, and some dentists can probably confirm that when you're seeing an osteopath before the treatment and during the treatment, the treatment lasts, it's not as long as it should be. Everything moves really well and really faster than it should. So I think it's a good investment because, like, for example, instead of having your braces for 2 years, maybe you're going to skip a few months. And a few months in a teenager's life can be...
It's a lot.
It's a lot, yeah. So before, during, and after to balance the body. And we don't necessarily need to see them a lot, but see them before to release all the possible tension, to make sure that they're mobile, they're well balanced in their posture. Then follow up, like, during the treatment, like for example, if they have some adjustment, with the elastic band, sometimes you have to put more tension with the braces. So maybe you can see them after some big adjustment to see how the body reacts. And sometimes you say, okay, that kid is well adapting to the braces, and that kid is not well adapting. So we're going to help them to be more mobile and to adapt to that new that change in their body.
What would you recommend? More like hard sitting braces or brackets, or those things that you can put in Invisalign?
Yeah, we call it Invisalign too.
Yeah.
I'm very confident in the dentist, the orthodontist, so I will be part of their team, but the decision is more on their side. I would say that with teenager, I see a lot of conventional braces more than Invisalign. In Montreal, the information that I've got from the dentist is that, like, they're more mobile, so they need a little bit more conventional treatment. So we're doing more conventional treatment at the moment than Invisalign for kids and teenagers. Yeah.
Yeah, very interesting.
Yeah. And when it's funny that we're talking about the braces, because when I'm assessing a baby, like a newborn, I'm always assessing inside their mouth. I want to see the shape of the palate. I want to see the suture. I want to assess the suction reflex. I want to assess the movement of the tongue. And I always look at the palate. And sometimes I told the parent, okay, just to mention you that the palate is very narrow. So we can work on that, because if you work on the base of the skull, on the cranial sphere, on the cervical spine, on the dura, on the membrane, when you do what an osteopath is doing, so working globally, for sure the palate can expand by itself if there's not a lot of tension in the body. But sometimes it won't expand as it should. So I always tell the parents, so just keep that in mind. So maybe you should like check with your dentist to have an opinion, because for some of them, they're going to have a palate expansion at 5, 6, 7 years old, and you can have really, really good result only with that.
Oh.
And I see that in my practice way much more those years than 10 years ago. And some kids will just need one palate expansion and the treatment is done.
So even with persistent, maybe inflammatory stuff going on in the maxilla as well?
Yeah, for some of them, they can have really good release and really good results. Yeah. You're opening the face.
So this is very interesting. I think maybe it's a little bit out of the topic. We actually wanted to do some other questions, but I think it's very important because that's something that's coming more and more to us.
Yeah.
And even having a lot of blockages here with the cranial nerves. It's a problem maybe even with the parasympathetic system. So how do you maybe address for those kids the parasympathetic system? Do you have any maybe recommendations for the parents what they can do just to address?
Would you say like more with like teenager with braces, or in general?
Well, in general, maybe, because we skip from very small to bigger ones.
Yeah.
So maybe we can, maybe there's something universal where you say this is something that is very good. Yeah, I always recommend.
You know, I'm working a lot with some basic reflexes, what we call the archaic reflexes. And if some parents are listening to the podcast, maybe they should go check a little bit information online about one specific, the Moro reflex.
Yes.
And the reflex, maybe people will recognize it's a reflex when your baby seems to be very agitated. When he hears a big sound, he's going to open his arms, he's going to start crying. So it's a very normal reflex that we see on newborn, especially around like 2 to 4 months. And when that reflex is there, it means that your nervous system is in good health. So we need to see that reflex. But for some babies, for example, if they experience a lot of compression when they were in the mommy's wound, if there was a lot of compression during the birth process, compression to the spine. So sometimes you feel that the nervous system is overexcited. So you can have an increase of those reflexes. So it's the typical crying baby. He cannot tolerate to be on his back. Every time, you know, the parents are telling you, okay, he's sleeping in my arms. And as soon as I'm placing them on his back, he's waking up and he seems to be very, very nervous, very awake. Sometimes it's the Moro reflex. And I think that we can really work on that as an osteopath, and that we can have really nice results, because at the end, it's all about the nervous system. And we have nice way to address the nervous system in very simple way. Like if we just think about the sacrum. So we're working on the pelvis, we're working on the sacrum to make sure that the sacrum is mobile. All the spine, that there's no tension on the dura, that every vertebra is mobile, that there's no adhesion between the membrane and the spine. The base of the skull for all the cranial nerve, the membrane of the cranial sphere. So we can address as osteopath the nervous system to make sure that we can calm down the nervous system, and the reflexes are still going to be there, but not overstimulated. I give a lot of exercise to parents, just like advice, because when you understand the anatomy, you can give some advice. Say, okay, maybe if you stretch the spine a little bit in a very comfortable position, you're going to inhibit that reflex. So sometimes, it's only little tips that will make a huge difference on the baby's everyday life and the parents' everyday life. Osteopathic intervention, a lot of exercise.
What kind of exercise?
It's funny because this morning I was teaching and we were talking about the Buddha position. So it's a way of holding the baby. So you're holding your baby back to you. So the back of the baby is against your thoracic area, and you're placing the baby more in flexion. So the hips are in flexion, the knees are in flexion. He's facing and looking in front of him. The arms are relaxed. Instead of placing your baby on your left hip to make sure that your right hand can cook, can open the door, can prepare a meal, you place your baby back to you and you try to balance them from side to side instead of shaking them up and down. So this is the kind of little tips that we can give to the parents as osteopath. And why are we giving those tips? Because we know about the anatomy. So we're looking at the posture of their baby and say, oh, that baby is a lot in extension. It means, he's pushing backward. When the parents told you, oh yeah, my newborn is so strong. He's standing on his feet. Yes, but maybe he's a little bit too strong. Maybe his muscle tone is a little bit high. So he's not only strong, he has some tension. If we release those tension by our osteopathic intervention, and if we work on the posture by exercise, we can release the nervous system. And and they're feeling so great after, because if a baby is more comfortable, he's gonna sleep well, he's gonna drink well, he's gonna gain weight, he's gonna have less digestive issues. So that's one of the tips. But I'm a therapist who gives a lot of advice and exercise, because I think in our practice, and it's the same for adult, for everyone. When I started my practice 20 years ago, people were coming to see an osteopath and say, okay, I'm gonna lie down on your table, fix my body, and I'll go back home, do the same as I was doing.
Yes.
That doesn't work.
I'm totally with you.
So you need to, you can lie down on my table, but back home, you have homework to do.
Yeah.
So you have to change your posture. You have to do exercise. You have to drink more water. You have to go for a walk a few times a week. So for babies, it's the same. They have homework to do. And as I told my student this morning, and I always told them, like, even if I show you the nicest osteopathic technique, the more complicated one, if they go back home in a bad posture, your intervention won't work. So as an osteopath, you have your part of the job, the parents have their own part, the baby has, so everyone has to be involved, and doing exercise at home, it makes a huge, huge difference.
Yeah, and it always sounds a little bit negative, I think, exercise. It's just implementing the way we live, and this is what always our nervous system is experiencing.
Exactly.
So this is what we have to do, all of us, even though it doesn't work all the time because we are not trained from the beginning on. But this is, I'm totally with you.
Like, for example, if you have a baby with plagiocephaly, so he has a flat head on the right side. So since he was born, he was always looking on the right side. So the nervous system is getting different information because he was more looking to the right. So even if you correct the position of the the bones, if you work on the membrane, if you work on the mobility of the neck and spine, if you release the pelvis, then you have to give the information to the nervous system that, hey, there's something on the left side. Because maybe he never looked at his left hand. Maybe he didn't experience, and at that age, their nervous system is growing so fast. So if you don't have enough stimulation, you won't do the task. Yeah. So if you're looking to the right from the beginning, you will keep looking to the right.
So you always get the information out of that side.
Exactly, and your nervous system as a baby don't know that you should look to the left. So we have to integrate at home. So when I say exercise, sometimes it's only taking a position, being in a posture. It can be very, very simple, but it's in your everyday life, and then you're going to see really great change.
Yeah. Thank you very much for this awesome interview.
I hope it will give some tips to the people who are listening. And as I always say to my patient, you know, as osteopath, we don't want to sell treatment.
Yes.
I think all osteopaths have like nice practice. My schedule is full, but I think that we need to inform people that first we're not solving everything in one session.
Yes.
So sometimes you need 2, 3, 4 sessions. Sometimes you have to come back a few times during the year to take care of that body. So we said with kids and babies that different motor skills acquisition, but for adult, for teenager, it can be like different period of their life where they experience new stresses in life. So take care of your body. We take care of our car.
Yes.
We need to take care of our body.
Thank you very much.
Thanks to you.